Are you going to be breastfeeding in the hospital? Let me give you some insider tips on what to expect.
Hi, I'm Gabby. I'm a lactation consultant with over 11 years experience helping moms breastfeed. Make sure to like and save this video and follow the postpartum nurses for additional tips with breastfeeding and postpartum care. So the number one thing that I see that parents aren't really expecting is how much your baby is going to want to feed. They are going to want to feed a lot. Honestly, the first 24 hours of life, they're pretty sleepy. They should be feeding about 8 to 12 times in a 24-hour period. Usually breaks down to about every 2 to 3 hours. Now, they can be really sleepy where they need assistance waking up. Even once they get latched onto the breast, they need stimulation to keep feeding. That is 100% normal. But the one thing that really gets parents that they were not expecting is cluster feeding, okay? Cluster feeding happens the second day of life. The baby's finally waking up more. They are more interested in feeding. I call them like little baby cookie monsters because it's like more. All they want to do is feed. And it can be very stressful and overwhelming for parents because they expect their babies to basically just eat, sleep, and poop. Well, yes, they do that, but they feed a lot. Now with cluster feeding, the babies can feed every hour, maybe every 30 minutes, maybe it's every 2 hours, maybe it's every 10 minutes. It is a lot. So essentially you will feed the baby. Your baby falls asleep at the breast, nice and content. You try to lay your baby back down in the bassinet thinking you're gonna get a little bit of a break. They wake right back up. They're rooting, they're crying, they're getting fussy. You put them back to breast to feed. They fall asleep after a couple of minutes of feeding. You're like, okay, we got it this time. You lay them right back down. Nope, they wake right back up looking to feed again. They're crying, they're upset. You put them back to breast. Now that lasts about a good 12 to 24 hours. And again, it can be very stressful, but it's normal. Keep feeding your baby. A lot of times parents will start to ask if now is a good time to do pacifiers. Don't give a pacifier right now, okay? You really need to focus on breastfeeding, putting your baby to breast. So what happens when you give a pacifier is that you're actually hiding those hunger cues that your baby is trying to show you. So instead of giving a pacifier, you should be putting the baby to the breast. The other thing is you are not going to really feel a lot of breast changes right now, okay? Yes, you have your colostrum. The colostrum is everything that your baby needs right now, but it's not going to fill your breasts like when your transitional full milk starts to come in. In about 3 to 5 days, that's when you're really going to notice those breast changes. Okay, so don't be alarmed if you don't feel that your breasts are feeling heavy or anything like that. And lastly, feeding cues for your baby. Pay attention to, is your baby smacking their lips, sticking out their tongue, rooting around? Even if they're laying nice and quiet in the bassinet, eyes open, just quietly looking around, perfect time to get them latched on. Let us know about your breastfeeding experience while